Hi, I'm Dr. Feinstein. Thanks for coming to our website, and you're here to take a look at our 5-minute test to find out if our 15-minute bladder procedure would be useful for you and would help you to end your problem with incontinence. I'd like to go through the test with you section by section. You might want to print up the entire 5-minute test just so that you can go through it more easily and print your answers as you go through it. The first section talks about the symptoms of stress incontinence, and it's very simple. Just mark yes next to the symptoms that you may have. And we would like to know if urine leaks out when you sneeze, cough, laugh, when you have the flu, when you're jumping up and down, when you're doing vigorous exercise, when you go on a trampoline, when you lift anything heavy, push anything heavy, carry anything heavy, when you lift the grandchildren, when you're dancing, when you're having sexual relations, when you play any sports, when you run, bicycle, kickbox, when you play volleyball. If you answered yes to these questions, you have stress incontinence, and it's very likely that our 15-minute procedure will help you tremendously to fix your problem. Section 2, how much does it bother you? If it doesn't bother you, it's not worth fixing. So on a scale of 1 to 10, we'd like to know how much does it bother you, where 1 means not at all, and 10 means you don't want to live with this problem any longer because you're tired of living with it. You've had enough. So please put down your answer. And in my opinion, if your answer is 7 or more, then it bothers you sufficiently that you should have the surgery. The surgery will help you tremendously. The surgery will get rid of a problem which is very annoying. This is a quality of life issue. It's not a life and death problem, but it is a very important problem from the point of view of quality of life. And if this is annoying, if it's impinging on your quality of life, if it's affecting you, slowing you down, causing you to be depressed, this is easy to get rid of, it's easy to fix, and if it bothers you sufficiently, it should be fixed. Number 3, protection. Do you have to wear any protective pads? Do you wear any panty liners for the leakage? How many pads are you wearing per day? Are they damp or are they soaked? And are they sometimes damp or soaked depending on what activity you're doing? Do you wear adult diapers? Do you have to wear adult diapers with pads inside them? How many diapers a day do you wear? How many pads do you put inside the diapers? Please mark these down. If you're wearing pads, it's an annoying problem. If you're wearing diapers, it's a severe problem. It should be fixed. Section number 4. Do you have weak muscles or do you have ISD, which is intrinsic sphincter disease? That's a separate type of problem. And if you have that problem, the 15-minute procedure may not be adequate for you. You may need a different type of procedure. How do you know if you have this ISD or intrinsic sphincter disease? Do you wear more than 4 pads per day? And do you soak the pads when you change them? Are you wearing more than 2 diapers per day? If you're soaking through 4 pads or more per day, if you're soaking through 2 or more diapers per day, it is possible that you have ISD, and if you do, we need to do specific tests to find that out, and the treatment may be different. The standard procedure may not work in your case. Section number 5, do you have OAB, overactive bladder? OAB can be 2 types, dry overactive bladder and wet overactive bladder. How many times do you wake up at night to go to the bathroom? Do you have to run to the bathroom in a big hurry? Do you have to break down the bathroom door to get inside in a hurry? If there's somebody waiting online, do you have to knock them off the line to get in there in a big hurry? Does it leak before you get to the bathroom? If you answered yes to these questions, then you have wet overactive bladder. And the treatment for wet overactive bladder is not a surgical treatment. It's usually a medical treatment. So if your problem is predominantly wet overactive bladder, there are medications that you can take. There's at least a dozen different medications that you can take for the wet overactive bladder. Only problem is you may need to take them for the rest of your life. So if you have wet overactive bladder, please mark that down on section 5. Section 6, have you had a failure of the standard medications? Have you already tried medicines for overactive bladder and have they failed? Have you perhaps not tolerated the medicine because of their side effects? Have you just quit taking them, or have you just not refilled them when the bottle became empty? We need to know if you tried the medicines and if they failed on you. If they failed, there are alternative treatments available of many different types for people where the overactive medications do not work. Section number 7. Many women have both problems at the same time. Stress incontinence, where they leak when they cough, sneeze, laugh, dance, etc., and the wet overactive bladder. This is very common. As a matter of fact, 65% of my cases have a combination of wet overactive bladder and stress incontinence. And logically, you should understand that fixing one without fixing the other is only going to fix half of the problem. If you have a combination of problems, both problems have to be corrected. And that's why many people have one problem without correction, because they don't recognize that they have more than one problem. So if you have stress incontinence together with overactive bladder, you're probably going to need surgery and medications together to combine to control your stress incontinence and to control the wet overactive bladder. Next section is section 8. Have you had a previous hysterectomy? If you've had a hysterectomy, we need to know when you had it, the reason that you had it, and we also would like it if you can get us an operative report that describes the technique they used in the hysterectomy. Having a hysterectomy will very much affect whether you have urinary incontinence or not. It will also cause you other problems, and it may cause you prolapse of different types. So if you've had a hysterectomy, a whole separate set of considerations has to be put into place outside of the routine, outside of the normal. Section number 9. Have you had a previous failure of surgery for urinary incontinence? Have you had previous surgery for urinary incontinence? Are you still incontinent after that surgery? In that case, this 15-minute procedure may not be adequate for you. You may need a different procedure with a different approach. There are many different options available for people who have failed previous surgeries done by other surgeons. Section number 10, pelvic prolapse. Do you feel something heavy in your private area? Do you feel something falling out of you? Do you feel a bulge in your private area when you go to clean yourself? If you answered yes to these questions, then you may have pelvic prolapse, and you can have pelvic prolapse separate and in addition to having urinary incontinence. If you have urinary incontinence, you may need that 15-minute procedure. If you have pelvic prolapse, you may need another different type of operation at the same time to fix the pelvic prolapse. That's important. We have to know the answer to that because you may need a different approach if you have pelvic prolapse. That ends our quick 5-minute exam, our quick 5-minute test. And what we'd like you to do is print the test. We'd like you to put down your answers. We'd like you to bring it with you when you come in for an appointment. We'd like you to call for an appointment at 847-291-9058. And through that phone number, you can either reach us in our office on Lakeshore Drive and Lawrence in Chicago, or you can reach us in our Northbrook office. The other thing you can do is you can email the completed test to us, and you can email it at Donna, D-O-N-N-A, at Dr. Feinstein, DoctorFeinstein.com, and we will get the test. You can call us, and we'll be happy to discuss it with you. When you come in for your first exam, there's a few things that we do need you to bring with you. Number one, we need a list of all the medicines you're taking, but not just the medicines. We need to know the doses and how many times a day you're taking them, and if you can tell us why you're taking each medicine. We also need a list of all of your medical problems. Do you have diabetes, high blood pressure? Do you have gastric reflux? Do you have any of a variety of other types of heart problems? Anything that would be important to us in considering your case. Also, we need to know what type of surgeries you've had in the past. Have you had any surgeries? And particularly, have you had any surgeries that affect incontinence? Have you had any surgery on the bladder? Have you had a hysterectomy? Have you had any surgery for prolapse? If you've had those, we have to know about them. So we'd like to thank you for taking this 5-minute exam. We'd like to thank you for filling it out. If you'd like to, you can bring it in with you to the first exam. And I do have a summary sheet that's printed, and I'd like you to fill that out, and that would just take a few seconds. Number 1, do you have symptoms of stress urinary incontinence? Yes or no? Number 2, how much does it bother you? Number 3, protection. How many pads a day are you wearing? Number 4, do you have intrinsic sphincter disease? Yes or no? Number 5, do you have wet overactive bladder? Number 6, have you had a failure of medications to control your problem? Number 7, do you have symptoms of more than one thing at the same time? For example, overactive bladder and stress urinary incontinence. Number 8, have you had a previous hysterectomy? Number 9, have you had a previous failure of surgery for urinary incontinence, and are you still incontinent after such a surgery? And number 10, is there a possibility you may have pelvic prolapse? So after you fill that out, we'd like you to send it to us, bring it to you. If you want to send it to us by email, there's a few things that we have listed there that we would like you to fill out as well. For example, your name, your address, your cell phone number, email address, your health insurance company, your birthday policy number, your social security number, the name of the insured on your health insurance card, and the birth date of the person with the health insurance, and the phone number of the insurance company, so that we can call them up and find out if there's any particularities that are important in covering you for urinary incontinence. And we would do that ahead of time before you came in for an office visit, so that it would all be there waiting and ready for you when you arrived. So again, thank you very much for filling out our quick exam. I very much look forward to meeting with you and discussing your problem with you, and I'm sure that we'll be able to help you to fix your problem and to live a better life with a much higher quality of life, and to get rid of this very, very annoying problem. But thank you very much for coming to our website. I hope you enjoyed it. Thank you.